Welcome back to my channel. Today, we will talk about global health system. There are a lot of developments in this field. We try to keep away from those conspiracy theories. Stay tuned. And as always, stay safe.
Okay, so you're here because you want to know more about global health systems and how prepared we are for the next pandemic. I get it makes sense, especially after everything we went through with COVID-19. And we've got some really interesting information to dive into for you today. A lot of it's coming straight out of that 2024 Global Pandemic Preparedness Summit that happened in Rio. Work, travel, even just meeting up with friends for coffee. I mean, think about how much COVID-19 changed. And that's exactly why we're doing this deep dive, to understand what it takes to be ready for whatever comes next.
Yeah, it's fascinating actually how COVID-19 really showed us all the weak points in our global health systems. And it's not just about having enough hospitals, right? It's about the whole system, making sure we have enough medical supplies, trained personnel, and really strong data systems. Those data systems need to be able to track and manage these outbreaks effectively.
Right, it's like we were totally caught off guard. Remember how everyone was scrambling for vaccines and PPE?
Yeah. Exactly, and that just brings us to a major issue, vaccine inequity. They were talking a lot about this at the 2024 summit, specifically this thing called the 100 Days Mission. The goal is to be able to identify a new disease and develop a vaccine for it within just 100 days.
100 days, that's pretty ambitious. How realistic is that even? What would it take to make that happen?
It's a huge challenge. It would take significant advancements in things like platform technologies. The mRNA vaccines they developed for COVID-19, that's a good example. We also need to be able to scale up our global manufacturing capacity really quickly. And on top of that, there are a ton of logistical and regulatory hurdles to navigate.
Makes sense. And talking about actually getting those vaccines out to people. What about COVAX, that global vaccine initiative? How did that actually work out during COVID-19? Did it meet expectations?
Well, COVAX was definitely impressive when it came to logistics. They shipped over 1 billion doses to 144 countries. But on the other hand, it also showed us just how big the problem of vaccine inequity really is. By the end of 2022, only 22% of people in low-income countries had received a single dose.
22%, that's a huge difference. What caused that gap?
There were a few things that played a part. Export bans from some of the main manufacturing countries, like India, for example. That alone took 90 million doses away from COVAX. We also saw problems because of relying on just one or two suppliers for things, which caused bottlenecks in the supply chain.
Yeah, that export ban issue really makes you think about how interconnected everything is. One country makes a decision and it has a ripple effect across the entire world. Which makes me think about how important early warning systems are now more than ever.
Absolutely. We need to be able to spot potential outbreaks before they get out of control if we want to stop future pandemics from happening. And that means looking beyond just human health. The One Health approach is all about recognizing how human, animal, and environmental health are all connected.
So you're talking about like disease detectives who are constantly out there tracking unusual illnesses, both in humans and animals, looking for any patterns that might point to an emerging threat.
Exactly. They'd be looking at environmental data, too, for any factors that could cause disease outbreaks. Like, remember those H5N1 bird flu cases we saw in the U.S. back in 2024? They were linked to infected cattle? Or that new strain of Mpox in Africa? That one caused over 17,000 infections and 500 deaths. All of this really highlights how much we need strong global surveillance systems, plus preemptive screening of high-risk populations. And it needs to be easy for countries to share information quickly.
Yeah, those cases are definitely a wake-up call. The 2024 summit was pushing hard for global cooperation,
Right.
not just in terms of surveillance, but for everything, sharing resources, aligning policies, and helping countries that need it build capacity.
You're right. International cooperation is absolutely crucial. And one of the biggest things happening in that area is this push for a global pandemic agreement. At the 2024 World Health Assembly, governments committed to finalizing this agreement within a year.
That sounds promising. But I'm sure there are some disagreements happening during these negotiations. What are the main things holding them back from finalizing this agreement?
Well, negotiating an agreement on this scale is extremely complex. Some of the biggest debates are around balancing national sovereignty with the need for global cooperation. And then there's ensuring equitable access to vaccines and treatments. We need to learn from what happened before. And then, of course, there's the question of how to make sure there's enough funding. It seems like we always go through this cycle of panic and neglect, where the money for pandemic preparedness only shows up when there's a crisis.
Yeah, and it's worrying that 155 out of 195 countries haven't set aside any national funds to improve their pandemic preparedness in the last 3 years.
That's definitely a concern. And it shows that we need to completely rethink how we prioritize global health. This isn't just a problem for some far-off country. It's a global challenge that needs a global solution. It's interesting to look at how different regions are handling this. Southeast Asia, for example, they've been dealing with these outbreaks for a while. SARS in 2003, the H5N1 bird flu, and then, of course, COVID-19. They've really had to adapt and refine their pandemic preparedness strategies.
Yeah, like trial by fire.
Exactly, and they've learned a lot from those experiences. Think back to the SARS outbreak in 2003. It didn't hit Indonesia as hard as some other places, but it really showed them where their regional health systems were weak. They realized they needed better surveillance, quicker response times, and more transparency in their communication.
Those seem like pretty important things to have in place for any pandemic response.
Absolutely. And then you have the H5N1 bird flu outbreaks in the mid-2000s. That was a big turning point for Indonesia. They had to really ramp up their veterinary public health measures, tighten up biosecurity on poultry farms, and improve coordination between animal and human health sectors. That's where the One Health approach really came into play.
So even before COVID-19, they were already building up some expertise in handling these kinds of outbreaks.
Yeah, but COVID-19 really put those systems to the test. Indonesia, being an archipelago with a decentralized government, faced some unique challenges. Their response initially was slowed down by delays in testing and contact tracing. A lot of countries had that problem early on.
But they adapted and learned from those early setbacks, right?
They actually did these things called intra-action reviews throughout the pandemic to figure out what was working, what wasn't, and where they could improve. This helped them make important changes to their national pandemic plan, strengthen their surveillance systems, and come up with more detailed contingency plans at the local level. They really embraced this idea of constantly learning and adapting.
That flexibility seems really important when you're dealing with something as unpredictable as a pandemic. Did you see any examples of them using technology to improve their pandemic response?
Definitely. Indonesia, for instance, expanded their digital surveillance systems quite a bit. It made it easier for them to track and analyze data on things like influenza-like illnesses. That can be an early sign that something bigger is happening. Using data this way is becoming more and more common in pandemic preparedness.
Like having a better radar system to catch those early warning signs.
Exactly. But technology isn't enough on its own. We need strong international cooperation, too.
And how's that going in Southeast Asia? Are countries working together?
Regional cooperation is a big focus there now. They understand that if one country has a pandemic, it puts everyone at risk. For example, they established the ASEAN Center for Public Health Emergencies and Emerging Diseases to coordinate responses to health threats across the region. They're also working on regional stockpiles of medical supplies and trying to strengthen supply chain connections so we don't see those shortages we had during COVID-19.
So they're pooling resources and expertise to be more unified.
Right, and there's this growing awareness that this collaboration needs to go beyond human health. The One Health approach is gaining traction both in the region and globally.
Yeah, it seems like a much more holistic way of looking at things.
Exactly. But even with all these positive changes, there are still big challenges.
Like what? Where do we still need to make progress?
Well, one of the most urgent challenges is making sure everyone has access to vaccines and treatments. COVID-19 really exposed the inequalities in our world. High-income countries were able to get most of the early vaccine doses, while a lot of low-income countries were struggling to get even a small amount of what they needed.
Yeah, it just shows that good intentions aren't enough. We need to fix the systems that create these inequalities.
Absolutely. There's been a lot of talk about helping developing countries increase their local manufacturing capacity so they're not so reliant on those global supply chains that can be easily disrupted. But there are still big obstacles like technology transfer funding and building the necessary infrastructure.
It sounds like we need a more coordinated global effort to make sure everyone has what they need to fight pandemics, no matter where they live.
Exactly, and that leads into another major challenge, strengthening global health governance. We need clear international agreements and frameworks to guide how countries respond to pandemics. We have to find a balance between national sovereignty and the need for global cooperation. And we need ways to make sure everyone is held accountable.
Is that what the negotiations for a new pandemic treaty are all about?
Yes, that's a big part of it. The goal of this treaty, which is still being negotiated, is to create a stronger and fairer global health system. But it's not easy.
What are some of the sticking points? What's making it so hard to get this agreement done?
I think one of the biggest issues is finding that balance between national sovereignty and the need for global cooperation. Countries want to be able to make their own decisions, especially when there's a health crisis. But if we want an effective pandemic response, we need transparency and coordination. And sometimes that clashes with national interests.
It does seem like a tough balance to strike. So how do you encourage countries to share information and resources without them feeling like they're losing control?
That's where these agreements come in. They need to be clear and well-defined. This pandemic treaty is trying to lay out those ground rules, outlining what's expected when it comes to sharing data, allocating resources, and coordinating responses. It also addresses things like making sure everyone has equal access to vaccines and treatments, so we don't see the same inequalities that happened with COVID-19.
So it's creating a system that works for everyone, but also respects each country's individual concerns.
Exactly. It's about recognizing that we're all in this together. A pandemic doesn't stop at borders. A virus can emerge anywhere and quickly become a global threat. We've seen that happen over and over again.
It makes you wonder what the next pandemic will be like and how prepared we'll really be.
That's the big question, isn't it? We can't predict the future, but we can learn from the past. Every outbreak we've had, from SARS to MERS to COVID-19, has taught us valuable lessons that we can use to improve our preparedness efforts.
Are there any countries or regions that you think are doing a really good job with pandemic preparedness? Places that others can learn from?
There are a few that stand out, each with their own strengths. Take Argentina, for example. They faced some big challenges during COVID-19, but a lot of people praised them for their quick and decisive response. They implemented testing, contact tracing, and quarantine measures really early on. They also had clear communication strategies and strong social protection measures in place, which helped lessen some of the economic and social impact.
So they were able to use what they learned from past outbreaks, things like Zika and dengue fever, and apply those lessons to COVID-19.
Yes, they were very adaptable. And that's so important when you're responding to a pandemic. Every outbreak is different, so you have to be able to adjust as things change.
It's like having a good game plan, but being ready to change it up when you need to.
Exactly. And then there's South Korea. They're a great example of pandemic preparedness. They were hit hard by MERS in 2015, and they used that experience to completely revamp their pandemic response systems.
Yeah, that MERS outbreak was pretty scary.
It was. But South Korea used it as a chance to make real changes. They invested a lot in improving their testing capacity, their contact tracing infrastructure, and their public health communication strategies. So when COVID-19 came, they were much better prepared. They were able to contain the virus better than a lot of other countries, and they didn't have to resort to widespread lockdowns.
Sounds like their investment in preparedness really paid off.
Mm-hmm.
Are there any key takeaways from South Korea's experience that other countries could use?
Absolutely. Their success really highlights how important it is to be proactive. Investing in preparedness before a crisis hits can really make a difference in how bad a pandemic gets. Another key takeaway is the importance of universal healthcare coverage. When everyone can access affordable healthcare, it's much easier to control the spread of a disease. And that brings us back to equity. Pandemic preparedness has to address these systemic inequalities if we want it to be truly effective.
So it's not just about having the best technology or the most advanced surveillance systems. It's about making sure everyone has the resources they need to protect themselves.
Exactly. And initiatives like the Global Pandemic Preparedness Summit are playing a crucial role in moving us toward that goal.
Tell me more about that summit. What's it all about? And how does it help with global pandemic preparedness?
The first one was held in 2024. It brought experts from all over the world together to share knowledge, best practices, and resources. It was a platform to encourage collaboration and strengthen our global health systems. The main themes were things like equity financing technology and making health systems stronger.
So it's a good opportunity for countries to work together and learn from each other.
It is, but these summits and treaties are only part of the solution. We need to change the way we think about pandemic preparedness. For too long, we've acted like pandemics only happen to other people in other countries. But that's not true. We're all connected. A disease outbreak anywhere is a threat to everyone, everywhere.
That's a good reminder that we're all vulnerable and we all have a responsibility to do our part. So what can we do as individuals to help create a world that's better prepared for pandemics?
I think the first step is staying informed. Read articles, listen to podcasts like this one, and learn as much as you can about the challenges and solutions. Support organizations that are working to improve global health systems and pandemic preparedness, and advocate for policies that make public health and global cooperation a priority.
So it's not just about waiting for governments to take action. It's about taking responsibility ourselves and doing what we can.
Exactly. Pandemic preparedness is about protecting ourselves, our families, our communities, and our planet. It's about understanding that we're all in this together, and we have a shared responsibility to create a healthier and more resilient future.
This has been a really insightful conversation. Pandemic preparedness is such a complex and important topic. I encourage everyone listening to keep learning about this issue and think about what you can do to help create a safer world for all of us.
It was great being here.
Until next time, stay curious, stay informed, and stay healthy.